Hi, with 7 days to go for the NEET MDS exam, a lot of you would be stressed and tensed about how to go about preparing in the last 7 days. So we have brought this video for you about the last 7 days of NEET MDS preparation and a few tips and tricks about how to crack your exam on the day. To talk further about this topic, today we have with us Dr. Aamir, who's done his BDS and MDS from M.A. Rangunwala Dental College, Pune. After that, he had an academic position both as an undergraduate and postgraduate staff at the same institute. He is a senior consultant and content developer with the MDS Prep Mentors app. He is currently in Toronto for a year of scholarship program under the prestigious international team of implantology. He is also an enthusiastic academician and researcher. He has an amazing Instagram page where he posts a lot of content about prosthodontics. So if you're in Instagram and you love prosthodontics, it's a page you need to check out. We'll be linking those descriptions in our Instagram page. Hi, Dr. Amir. Thank you for taking out your time. I know that you're always available to all the NEET aspirants. And with 7 days to go, I know many of them will have a lot of questions in their mind. What they should prepare, how should they give their exam. And I ain't find anyone better than you to come and answer those questions. So my first question to you is, if you had 7 days to go and you had your NEET exams, MDS exams coming, how would you prepare?
Hmm, Good question. Thank you so much, Dr. Satish, for the kind introduction. And hello, students. I know with 7 days to go, there's a lot on your plate. We don't want very long narrative advices. We will keep it very short so that you know that what you need to do and what you, more importantly, do not need to do. Now, this phase of 7 days is where a lot of stress, a lot of pressure, this is like a self-inflicted pressure, and a lot of hormonal changes will come in your mind and body that you need to really put aside because these are barriers to what you need to achieve. The first thing that you need to do is draw a line, make a boundary as to what needs to be restricted. Do not attempt something new, fresh. Like, don't start overall with a new process saying that, oh, 7 days I still have this subject left, let me start this. My focus would be to best focus on the revision, best focus on what you've already done, and rather prepare more on the volatile things. Like, some questions are normally always present in the exam. Margin of tooth preparations, how much are the values? Say implant, how much is the distance from these vital structures? Composition of few dental materials and their percentages, some values of the physical properties. So these numerical questions: who gave this classification in which year? What is the current perio classification? So these new things that have upgraded, and more volatile things, more factual things, that should be my idea in the last week. Now, technically, because you have, say, 20 subjects and 1 week and you divide it and everything, you get 1 day and 3 subjects. But right now is not the time to break down things into subject. Right now, you have to deal the whole thing in one entity, because if you start dividing into subjects, then you are going to miss out on something. And it's more important for you to focus on what is your plus, what is your positive, and go for that. Prepare that stronger rather than starting from scratch.
Understood.
And
So
yeah, go ahead.
continue.
A lot of students will also feel that I'm not giving enough hours of preparation. Like, normally I would study 6 hours, 8 hours, 2 hours, whatever. Like, but they will feel that, no, now I need to boost my preparation to, double the hours. That is actually correct, because right now you want to maximize your preparation. So if you are going out of the way, feeling uncomfortable, feeling sleepless for a few days, it is absolutely okay. Don't hesitate in cutting down on your sleep, cutting down on your leisure time, on your social hours for this 1 week specifically. Until now, we've always told you that, don't stress about too much. But now, I think for the next 6 days, barring the last day, you should put in your 100%. Go 12 hours, 15 hours a day. It's the time to give it your 100%.
Understood. Actually, you answered my second question. I was going to tell you
Oh.
what about those people who are concerned about subjects they have not done. So you have told forget that and focus on the subjects you have learned. But now imagine I've studied quite a few subjects. There are some which I'm weak at and some which are my strengths. So how do I balance that?
Now that is a little subjective. So say out of the 18, 19 subjects or 20 subjects, I'm good with five, absolutely very good with five. I should just sit with these five subjects more towards the end of this week so that, they are just brush up. And when I'm more stressed, I can go to them because they have a plus positive. So they will reinforce my motivation. They are going to boost my morale when I'm, not in a good shape in my mind about something. So keep those subjects as your saviors for your mood when you have a little depressing kind of a moment. I would save those subjects for those moments. The difficult ones should be the ones that you should start your day with because you want your 100% concentration on those. So you plan your day in a way that you have a mix and match of everything. Don't leave out completely. This is, of course, I'm saying that you have 20 subjects, you have prepared 15. The five that you've not prepared, forget about them. Now completely
Understood.
forget about them. Like even if you want to see past few year question papers and all that, I think that time has also gone. So I would just keep those aside, put it maybe in a question mark kind of a state. Exam mein whatever comes we will see. If it's in your comfort zone to attempt it, otherwise just leave it aside. So those five subjects keeping aside, the remaining 15 subjects, so you take one easy subject, one difficult subject, one favorite subject, whichever combination permutation you like, but attempt, do justice to all of them if you have prepared them. If you have not prepared them, not the
Just
time
forget
right now.
them. Understood. What do I do one day prior to the exam? Just a pause. Please do not forget to hit the like button below because we put in a lot of effort to make content out for you here. And do you want to take your career to the next level? If yes, then I'm sure you need to subscribe to this channel below.
One day prior to the exam, what I would do is so by now you should know that these are your important topics. These are some things that are commonly asked in the exam. Make a note of all of them. I'm sure you must have done that. So last day is only for that quick revision for everything, regardless of the subject or the factual conceptual matter. Doesn't matter. If it's important, if you think these things need a revision at the end, that is what you revise on the last day. But also make sure that the last day is not very harsh on you. You should be looking at the preparation for the next day. I would always keep in mind what I want to wear for the exam, something bright and positive maybe. So all that kind of preparation should also, you should be excited for the exam, not too stressed about it. Eat well and go. You should be thinking about how your commute is going to work out and this and that. So that should be your last day, more of sleep, relaxation, and planning for the exam day rather than revision, books, and notes. So whatever books and notes is required should be part one of your day, but the part two is the execution part for the next day. So your planning should be, your focus should also equally be on that part of the next day.
Understood. Now, what if I go into the exam hall and I'm stressed? How do I go about giving the exam?
Of course, you will be stressed. You've been working for this for a year, and it's normal to feel stressed. There's nothing you can do about this except for you have your own stress coping mechanisms. Maybe you can just relax, stay away from people. Some people want to talk to other people, and that makes them stress free. Some people drink a lot of fluids, that makes them stress free. So you do whatever you feel good, but it's okay to feel stress in this kind of an atmosphere because this is exam anxiety. This is very normal, and once you enter the exam hall, this will completely suppress. And don't take too many things with you and add additional stress of keeping your phones here and keeping your books there because there may be no facility to keep that. So don't add anything that adds stress, like I will look at my travel when I wake up. I will book an Ola Uber in the morning. Try doing all of that in advance so that you have minimal stress and it is only the exam that is stressful and nothing else associated with it.
Understood. Any tips on giving the examination?
Tips on giving the exam, I would say that attempt as much as you can. It is okay to take a few guesses, but if you are completely not sure about anything, skip it. Say 15, 20 questions you can skip out of the 240, 220, 200 to 220 on an average. You should attempt to be in a good scoring window. And on the day of exam, it's better. Like I'm sure most of these students have taken mocks here and there somehow. It's important for you to be very familiar with the pattern of how it works and just read the instructions carefully on the website on whatever reading material you can get so that you don't have any surprises on the day of exam, right? So you need to be sure of the exam pattern, the way it works, and that will just make it easier for you. Attempt the easy questions first. If you think that a question is taking too much time, just skip it, come back to it later. Do 2 rounds of attempting. So in the first round, whatever you can answer, just go through. If you think something's not making sense, skip it. If you get stuck on one question, then it's going to cost you time for the other questions, and you don't know what kind of questions are waiting for you ahead. It could be very lengthy kind of a paper. One paper I remember was only case and clinical based questions, and it was very lengthy. The case histories was so lengthy, it is difficult to read the whole question in a stipulated time. So if you think it is a very lengthy question, come back to it later. Don't waste your time on that. That is one advice I would really want the students to give. And after the exam, uh, I would also like to tell students that don't be in the anxiety to find out the right answers and see how much I have scored, see what has happened. It is good to have an overview in your mind that I've performed well or not. But when you do that, you start self doubting, and that is going to really upset you till the time you get your results. So you've worked enough, just trust the process. Don't, make it difficult for you after that. If it's not good, it's okay. If it's good, that's very good. But don't try to dig your own grave and ruin the rest of the few weeks till the results are out. So that is something that I really want to tell students
Understood.
who are appearing.
That's a really good advice because I've seen a lot of people beat themselves up even before the results come. And when the
They go
results come, they
crazy.
are,
Yeah.
yes, they're surprised that they did really well. So
Hmm.
give it all in your last 7 days is what Dr. Amir's advice is. Do not
Correct.
forget, you can cut down on leisure times, cut down on everything. It's like the last phase of your marathon. Give it your all. But one day
Absolutely.
prior, according to him, is you need to start focusing on giving the exam. That's where you need to take your rest, take your sleep, have a lot of fluids, prepare how you're going to reach the place on time. Do not carry extra stuff because sometimes you won't get to keep it there and you'll be absolutely stressed at that point of time. So stress about the exam, but not about how are you going to reach the place or give your exam. And during the exam, his advice was focus on finishing all the easy questions first so that you can get a second round to answer the difficult ones. If you end up spending a lot of time on each and every question, you might not get time to even complete the paper. And try attempting at least 200 to 220 questions so that you have a good chance of getting through. That's a really
That's right.
amazing advice, and as always, you're there to help them out. Thanks a lot.
You're most welcome, Dr. Satish.
If you are giving your NEET MDS for the first attempt and you have further attempts, then do not forget to check out our other videos on NEET MDS as well. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed.